Hi, my name is Phil. I like to talk about politics. In this video, I'd like to discuss the not at all surprising reports, I suppose, that the scientific government advisors not only told ministers to step up their test and trace programme way back in February, but also came up with a plan which may have allowed us to do it, but was never actually attempted. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, the UK did actually begin with a test and trace strategy. How we started off was fine. You know, we carried out tests. Where people tested positive, we identified the people they'd been in contact with, told them to isolate until they could be tested and ascertained that they were not themselves infected. And that was fine. And then we abandoned it fairly early on as well, which is well known because it was publicly apparent that we abandoned it. And we sort of knew at the time, if we were paying attention, that the government scientific advisors would not have suggested dropping it in favour of the herd immunity concept. One thing that a lot of us were doing right from the start on this when the government did this was to say, because the government were trying to say that their scientific advisors, this is what we need to do. Whereas a lot of us were saying, okay, how come your scientific advice is A, not being publicised, you know, why can't we see the minutes of these meetings, and B, different to everyone else's scientific advice? Why is your scientific advice different to the rest of the world's? You know, and it was odd to hear the chief scientific advisor talking up the herd immunity plan. But, you know, he is a political appointment. He is a scientist, but he's not necessarily the best scientist to have for a situation like this. And he is appointed by the Prime Minister for his political views. But it would have been really, really surprising if other scientists in SAGE, that's the Scientific Advisory Group for Emergencies, had also agreed to it. But we couldn't really know because they weren't making the details of minutes known. But exactly what SAGE scientists did advise in favour of, as well as against, like I say, wasn't easy. Some had gone public about their view, so we knew where some people stood on it. More of them, in fact, have been going public since ministers not only started attacking scientists for their mistakes, but also as a result of completely going off kilter in terms of scientific advice, and in fact doing the opposite of what the scientific advice would be. But like I say, we never really get to see the minutes of these meetings. Just little snippets. Every now and then they release a little snippet, a bit of a report on what was discussed. We keep being promised that these minutes will be published. Doesn't seem to happen. But a new little snippet, a little report, has now been prized out of government and has revealed that the government were told back in February to massively scale up the test and trace. So the idea that the government was saying that their scientific advice was to abandon it, completely debunked now. That was not the case. In fact, they wanted us to adopt a call centre type arrangement, very similar to what we have now adopted, you know, but at the time they wanted, you know, a tenfold increase in this, using this method. Now, we know it wasn't as simple as just scaling up the test and trace programme. You know, when you compare it to, you could look at other countries. Other countries were just able to scale it up. The countries who actually managed to keep a lid on this. We couldn't do that because the difference between us and those other countries is those other countries' infrastructure allowed them to do it because they didn't have a government who had shagged their national and regional care systems for the past decade. Boris Johnson himself had to admit, under questioning from Keir Starmer a few weeks ago, that the country just wasn't capable of simply scaling up the test and trace programme that was initially conducted. But it does seem that there was a plan suggested by SAGE which could have been feasible. We'll never really know because it was never tried. Instead, Dominic Cummings, at this point, convinced of the idea of letting the virus run rampant in order to keep the economy open and develop this herd immunity, you know, and therefore give us an economic advantage over countries going into lockdown. Remember, at the point we were before this pandemic, we were already going to stuff our economy over with Brexit. Here was a chance that I don't know this, I imagine this was the thinking. Here is a chance because other countries that would have looked better than us economically in the EU are now going to be stuffed by the lockdown. If we don't go into lockdown, we can keep our economy going. We can compensate for the damage we're going to do with Brexit, and we can hide the effects of Brexit. Obviously, that didn't work out because the idea very quickly sank like a lead balloon when it was pointed out just how many deaths would be on Boris Johnson's hands. But much of the damage had been done by then because we had let the virus run loose. We couldn't then just go back to the test and trace. Now, since then, you know, the Prime Minister has regularly tried to deny that the herd immunity plan was ever a strategy. Oh, no, it was never a strategy. It was just a byproduct, even though he went onto television to promote this idea. And as I say, when asked why we didn't step up the test and trace program that we began with, he kept saying, well, it wasn't possible. We didn't have the facilities. But this report is saying otherwise. Public Health England and a team from Cambridge University both believed that the proposed plan would work and would allow for that tenfold increase in capacity, which would have coped at the time. Now, that would have allowed us to have maintained control over the spread of the virus. It would still have had to have been ramped up over time, of course, but that would have allowed us to maintain what we now know and what we really knew at the time allows you to keep a lid on it, because other countries have shown this. Now, the same reports did note that contact tracing in this way would be ineffective if the number of new infections was ever such that you'd need to be contacting 8,000 people a day. That was a bridge too far, which of course is very much beyond the stage we're at now. That is the nonsense of, now that we've adopted this plan months later, we're actually beyond the point at which they said it wouldn't be very effective. Because never mind needed to contact about 8,000 people a day, at the moment we need to contact about 45,000 people a day, you know, and there's no figures available as far as I can tell from the government. Certainly Boris Johnson wasn't able to provide them when asked about how many we were actually contacting now that this plan is in place. And so what we've done is very late on adopted measures that would just about have kept a lid on it had we done it back in February. Now we're trying to do it, but in a very ineffective way, where it will not do the job that's required at all. So there it is. That's where we are. We now know with absolute certainty, it's not hearsay, the report is out there, that scientists absolutely did not advise that the test and trace program be abandoned for something else. That's what the government said. They were lying. We knew they were lying, but now we know they were lying. So I hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.